You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have an expert on the topic. She is the go-to person in Orange County when you want a natural-looking smile. With us, we have Dr. Rich. Dr. Rich, welcome to the program.
Thank you very much, Randy.
Now, thanks for coming on our program. And I've wanted you on, actually, for quite some time. I visited Orange County and stopped and got a chance to take a look at what you're doing over there. Now, for people that don't know you, tell us a little bit about your practice. Who's your typical patient?
All right.
And what are the different procedures you do?
All right. Age 11, I knew dental was my chosen field. I was just drawn to it. I've had a passion ever since that age.
So what creates a beautiful smile? Like, what defines it?
Okay.
If you had to say.
There are many factors. So we're dealing with this lower third of the face here, let's say.
Okay.
And from the cosmetic standpoint, we tend to divide the face of what makes a beautiful, handsome person. What are the characteristics that does achieve these looks? So dealing with this lower third, we want the lips to frame the smile. And when we smile, we want to see all teeth. We want to see white. We don't necessarily want to see the gum tissue too much. We don't want to see dark spaces down the side that we call the dark corridors. We want to see a nice level smile line of the teeth. We don't want teeth going up and down. We don't want gaps. We don't want wear. We don't want dark. We don't want fractured, broken, crowded. And we want the lower lip to just go right along the edge of the biting edge of the teeth.
Do you go through this education with patients? Because I know you wanted to show that to me.
Yes.
So you show this to patients.
Yes,
What am I looking at here?
Okay. Well, pretty much what we've spoken about, the lower third of the face is so critical. What happens to a lot of our patients, especially as our population is aging, the bulk of our population, maybe our 40s, 50s to 80 years old, if they're not getting proper education about their bite, occlusion, and so on, what's happening is this lower third of their face is diminishing or shrinking, and we get a premature aging going on, not only aesthetically but functionally. So the cheeks, the facial skin, all of the drape starts to kind of cave in. Mm-hmm. And we also then put pressure on this temporomandibular joint zone here. So there are a lot of things to protect. We want to protect the teeth from collapsing or splaying out. We don't want the teeth coming out this way. We don't want to overstrain the bone, the jawbone, the gum tissue, the teeth. So we have to keep everything in balance.
So it's more than just putting veneers on teeth.
Oh, absolutely.
Because it seems easy to me going into this. But there's a lot to it, I guess.
There's a lot to consider, a lot of things that are done in the preliminary stages, in the planning stages, in the laboratory stages. That's why we're so fortunate to have our own laboratory right there in our office. We have a 9-man laboratory run by our wonderful...
That make the teeth.
Yes, they do all of our work for us, whether it's implant retained dentures, bridges, whether they're veneers, and whether they're protective night guards. It's made there in our laboratory. So we're very fortunate because I'll invite the ceramist into the treatment room with the patient and with the assistant and
That's the person that makes the teeth?
Yes, yes,
Okay.
and he is an artist. So he comes in with his rather sophisticated camera and he's watching her speak or watching the patient speak.
Right?
And we're looking at phonetics, we're looking at the height of the person, we're looking at skin tone, eye color, hair color, teeth color, and taking all of these nuances into account. And then he's flashing pictures close up and distance. So he's got all these pictures around him at his cubicle while he's constructing this smile that we've designed.
Okay.
Yes. So it's really...
to get a great end result.
To get a great end
Now,
result.
people need to know, I mean, it's a real interview. I'm not siding with you or even endorsing you on this program.
Right.
But I did, and I rarely visit the doctors before I interview them. But in your
Yes.
case, I was in Orange County, and I said I was going to drop by.
Yes.
You said, you've got to meet my lab people.
Right.
These are the artists that make the teeth.
Yes.
And you just kind of introduced, they got out of their chairs. They treated me great. But they were talking about what they do and how they paint the teeth and do all these different things. And one of them, I overheard, it was a female. She said, they were talking amongst each other. She goes, I didn't even sleep last night because of that.
Yes.
They were talking about maybe we went too dark or too light or something like that.
Yes, they really take it to heart.
So they're serious.
They are very serious.
Good.
They have a passion for it, which is great because we have a team like that. You know, there is a great deal of passion, and our patients feel that. They feel that, you know, we really care about the outcome, and they love it. They thrive on it, you know, and sometimes we'll almost apologize for being so picky, and they say, no, no, it's great, go for it. You know?
So do you consider yourself a perfectionist when creating a smile?
Oh, yes. Yes, you have to be.
And you have great, and for people watching this, her photos are fantastic. I told you I'm not endorsing you, but these
Right.
photos are good.
Thank
How
you,
important is a smile? In this economy, any economy, why invest in your smile if you don't like it?
Oh, my goodness. Well, if you look at, let's say, the English Journal of Dentistry or the British Journal of Cosmetic Dentistry or the American Academy of Cosmetic Dentistry, and look at those professional journals and see what they say about what a smile conveys. Okay, they say that a smile conveys intelligence,
Okay.
education, cleanliness. This is a great smile I'm speaking of. Okay.
Yeah, yeah.
Okay. Good grooming, success, self-confidence, and friendliness, approachability, and trustworthiness. Now, these are all fabulous attributes. Who wouldn't want all of those?
Yeah.
And in this life, you know, we need these too.
Are there a lot of people that don't like their smile? Like in Newport Beach, I mean, are there people, do they come in and they say, Doctor, I have hated my smile for a long time? Is it really that common?
There are a lot of people who are unhappy with their smile who don't know what can be done for them. They've lived with it so long, and maybe they've resigned themselves because they gave priority to their children or their grandchildren or this spouse and so on. And you know, they're starting to get educated now that there are options available to them. And so many people have a great fear, as you know, I'm sure, of dentists.
Afraid of the dentist?
Yes.
Well, nobody likes going to the dentist, right?
No.
Do you hear it every once in a while?
Oh, yes, they say.
No offense, doctor.
That's it. No offense. You know, we like you. We just don't like what you do. But we want to change that. And patients come to the
How
front.
often do you hear that? Like, is this the worst mouth you've ever seen?
I probably hear that a couple times a week.
So why do you think they say that, though? This
Why-
is the worst.
Well, they've been hiding their smile for years. Perhaps they've gotten some negative response. And people who don't smile don't come across as friendly or receptive, or people think they're maybe conceited. And they
Or
get
stuck up or something.
Yes, they get misread a lot. And I think that becomes incorporated in the personality and who they see themselves as, which is very unfortunate. And we get to witness a change that
You
takes
do?
place over
So
it
you will
is
change somebody's smile and you see them what?
They just step out of themselves. Their personality emerges.
Really?
They maximize all that's good. They become bigger than life in, you know, in modest ways. But for instance, one lovely lady who's very big in civic duties in Newport Beach actually got out of the chair. I've known her for a year, but finally she's seen some wonderful changes from some things we're doing. She got out of the chair and she exclaimed, "We took pictures last week, family pictures, and for the first time in my life, I didn't have to hide this part of my face because it's not caved in anymore. I'm full, I'm symmetrical, I'm balanced, my smile's beautiful." And she said, "And you know what? My husband's noticing and he's commenting on it."
Nice.
And she's out there dealing with the public all the time, so she's feeling really good about this. And I could just see a little jaunt in her step, you know, and I thought, oh, I didn't know that was your personality.
Now, for the sake of time, you brought some photos.
Yes, I did.
And you're proud of these photos.
Oh, very.
In the green room, I said, it's like you're showing me baby pictures here.
Yes.
So good for you.
All right. This photo is of a lady who's in a business where she's dealing with people all the time. And I think
Wow.
on the back of this, she wrote a letter.
All right.
And what you can see on this photo, what she didn't care about, her teeth, was that the front teeth were very dark. And when she smiled, which consequently she didn't, you would see a very gummy smile with dark lines from old crown. If you look at the corners of her mouth, both right and left, you'll see the dark lines there. And that's what kept her from smiling. Yet she was in a business that required looking friendly and looking approachable.
Okay.
So
So when you see that, what goes on in your mind? Do you think, I mean, do you see the end result?
oh, I do. I envision where she can go. And sometimes it's hard to show them with words, so we share other photos with them.
Other patients that
Other
you've
patients'
taken care of?
photos, yes. And also, occasionally we'll do something computerized for them. We have a smile art person who will design according to the guidelines I give him, what we want to present to this patient. And many patients are very excited, but I'll tell you, when they see the photo, then they believe and they say, really? I can look like that? And they're very excited, and then we proceed.
So let's take a look at the after. Wow.
She was so pleased. She sent me this photo. So she and her husband went to this restaurant, and they were seated amidst the crowd. And across the crowd came the maitre d' and singled her out to tell her, I just want to tell you, you have the most beautiful smile in the house tonight. She was thrilled. She had never been told that by anyone. So
That's
that made
very
her
nice.
day, and her husband was there to witness that and support her.
And you say they're not used to smiling, oftentimes.
No, they're not, because they've unconsciously or subconsciously been kind of keeping that quiet. That's kind of their dirty little secret, that they can't present that. The mouth is so personal, so private, and it conveys so much.
But it changed her appearance.
Oh, it did. And
no doubt about it.
yes, and although she had a very warm, outgoing personality, now she has no restraints. Okay, a few more things I'd like you to notice about this smile, Randy, is that it brings her to a more youthful look. She looks healthy and sophisticated and educated, intelligent. All those things that we talked about earlier is what is conveyed in her smile now. And it's just enhanced her whole face value.
What do they say when it's done?
I was going to say first dress to the teeth, but what they
Dress to the teeth?
Dress to the teeth, yes.
Interesting.
Dress to the teeth, then you're really well dressed.
Now, in Newport Beach, Orange County, women there are known for taking care of their skin, their hair.
Yes.
And I think we had a discussion in the green room, but there's a
Right.
lot of women that they have an older smile.
Right.
What's your take on that? And do you see a lot of that?
We do.
So why don't they do something about it? They don't think the smile's that important?
I think a lot of them don't realize what's possible. They have no clue what it can do for them until you see a picture. Seeing is believing. And they've lived with a smile that they've concealed for years and years, and so they try to maybe overcompensate. And they're very conscientious about, as you notice, their grooming, their dress style, and their hair, and so on. But they just don't know until we get a chance to talk with them. So they have to muster the courage to come in and let us share with them.
Okay, good. Now, do you have more? Is it more women than men?
You'd be surprised. I'll be happy to share with you.
So is it about 50-50?
Maybe slightly more women, but we have a lot of men.
Let's see
And
what we've
maybe
got
it's
for-
because I'm a lady dentist and I don't scare them. I don't know. So,
Yeah, that could be.
okay. So this patient works in a business where he's interacting with people all the time.
Nice smile.
Well, he wasn't comfortable with it.
Okay.
It's a young-looking smile. We're used to seeing gaps between children's teeth, but not adult teeth.
Interesting.
So he needed a grown-up smile that really reflected more of his leadership qualities. And it looked like perhaps he was trying to kind of masculinize a little bit with the beard and so
Okay.
on. So for him, what we did is we created a very conservative approach, and we made veneers.
Okay.
Okay, would you like to see them?
Yes,
All
let's
right.
take a look.
Okay. Now keep.
Wow. Yeah, this is very nice.
Now we want to keep in mind too, Randy, that people whose teeth create a great smile, they're the people who are first in line for jobs, for job promotions, for salary increases. They're liked. They're considered treated better.
But a lot of it is, do you think it's their self-confidence?
It's a
More so than their smile?
It's a combination. One begets the other, and it's hard to say whether the egg or the chicken comes first. Randy, look at the close-up before and after, and see what you see, and see what it conveys to
Yeah.
you. He looks like someone that you could entrust your business with, because he looks like he can take good care of himself.
Good point.
You see?
Okay.
That's conveyed. Yes.
And they look natural.
Yes,
I told you
they
I
do.
could spot veneers walking down the street.
Right. No, they're very natural. We make them very slender. It's very important. Again, art and science. We have to respect the gum tissue. We want them to look like they grew there. Now remember, my ceramist comes in and we look at everything. And teeth have multitudes of colors. They have yellow, lavender, peach, all kinds of colors. He has little striations in his teeth. He has little translucency. He has little texture, so the light breaks up and reflects back to the viewer differently. So these don't just look like plastic teeth that are stuck in there like a denture. These look authentic, and that's what we want. We want to exceed our patients' expectations and give them something that is going to have predictable longevity in both beauty and function and wear. Now here's another patient who was not pleased with her smile. You can see why. She had uneven gum line. She showed a lot of gummy tissue rather than tooth structure. The crowns were very bulky. Again, that's the mistake we see most often, so it looks unnatural. And then the corners of the mouth are darkened. But I want to point something out, Randy. At the top of the show, you mentioned that small differences can make a significant change in a smile, and this illustrates that, because we can raise the gum tissue maybe just 1 or 2 millimeters and create symmetry. We need symmetry and balance, and then the eye darts all over a thing of beauty rather than focusing on something that is like a blemish. So if a person feels like they don't have a blemish that's distracting their listener, then they feel more confident that the words and the message that they're trying to convey is getting across. And we all want to be understood, right? And that helps build communication. It helps build our relationships, whether it's professional or personal. I have another one I'd like to share with you here. All right, this patient comes to me and she's got spaces between her teeth. She's got metal showing from appliances, all very anesthetic. And she's in a high pressure job with a lot of responsibility, dealing with people all day long. So she's got to have an air of confidence, and she wants to project all of those good features that a great smile projects. But I want to point something else out that I'm going to be correcting here. The space between her lower front teeth, and then the space between her bottom teeth and the upper teeth, plus the lower lip needs to be parallel with the bottom edge of her upper teeth, and they're not.
Okay.
So these are all things that create an asymmetry that's not attractive.
Okay.
Okay.
So what'd you do?
So we did quite a few things, and if you turn over, you'll see we re-imaged her. We did a lot for this lady, so it would be hard for me to tell you in a very short while what we did for her. But everything in there is
like porcelain veneers,
porcelain crowns, bridges, everything's fixed, permanent, and lovely. And I want to share with you too that this lady, you know, a lot of my patients, once they get to this stage, they kind of go, they get an aha moment.
Okay, good. We have time for a few more photos.
All right, great. I have another male patient. His fiance made him come to me, and he had some discrepancies. Teeth were wearing uneven, etc., different colors going on and so on. He said if we could make an appreciable difference, he would have his teeth restored. When we were done, he said that is an appreciable difference. So,
very nice.
So Randy, he's a very happy camper. Do I have time to share a few more with you?
Yes.
All right, great. This lady came in, and she's a lovely lady. It broke my heart to see how chunky the teeth were and how irregular the bite was. You know, some are high, some are low, and showing gum tissue. So what we did is we got her mouth very healthy with hygiene. We took off the old dentistry, and we reconfigured everything to fit her mouth. Look at the old dentistry in the back. You see how it caves in?
The corners of her mouth?
Yes, caving in. So she needed a nice rounded arch form. She needed something that fit her face, fit her body. She wasn't short and chunky, so we gave her teeth that fit her and that she felt comfortable with. So they're slender, very slender teeth. They're very feminine. Teeth have feminine characteristics and teeth have masculine characteristics.
How so?
Women's teeth tend to be more rounded on the outer edges.
Interesting.
Yes, men's are a little more angular. Men's canines are often more pointed, and women's teeth are a little more rounded. But there's variations within that for both genders, which is nice because we have very strong personality women and so on. And here's another close-up of her so that you can really kind of just appreciate close-up what she's got.
I can see the curves on these teeth.
When we look at teeth, we make a subliminal evaluation. When we see flat teeth, we think that they're older. So when we see teeth that are curved, we think that they're younger
look.
because it is a youthful look.
Okay.
Yes. So we want to maintain that. This gentleman came to me, head of a company, so again, dealing with a lot of people. A nice sense of humor, but those teeth were not
Is that common?
Not suited to him. Well, it's much more common than you realize because people who have a smile like this don't show their teeth. They don't smile. and they come across looking serious or not friendly.
Okay.
So his wife, I think, encouraged him to go ahead and
he's a business guy.
take care of himself. So he came in. Yes, he's a business guy. And so we were able to bring those lower teeth out. We were able to resize the upper front teeth. Now look at the after. Tell me what you see.
What's very nice. I mean, he looks, like you said earlier, more sophisticated. They look natural.
Thank you.
And like you say, he probably has to learn to smile
Yes.
all over again.
Yes, yes.
Is that right?
Yes. And we find our patients, when they return to our office, they walk in now with a smile, whereas before they didn't. They were more timid. Now they're more extroverted. So they were just waiting to come out.
Now, do you think the public thinks that all dentists are doing the same kind of work? And again, I'm not trying to endorse you here, but do you think that the public thinks that, everybody can do cosmetic dentistry?
I think the public doesn't know.
There's a big difference?
There is.
So what do you look for? I mean, do you ask, let me look at your photos, let me look at what your work? I mean, I think seems like
What
the
should a
natural.
patient do when they're looking? Is that
Yeah,
what you're
how do you
asking
find a
me?
cosmetic dentist?
They should definitely ask to see before and after photographs. And have
That'll show their taste, right?
Yes, and have a
doc-
nice lengthy conversation with that dentist and see how that dentist listens and see if they feel heard. And what feedback can that dentist give to them that they know that they're really envisioning the same outcome together.
The fact that you have your own lab.
Yes.
I met and these people, again, one woman, one of your
Yes.
lab technicians,
Yes,
I overheard them talking. She said, I lost sleep over a tooth.
yes.
And I said, did I hear what you just said? And they were
It's true.
So the fact that you have your own lab, though, I want to ask, are you able to pass some savings on to the patients?
Oh.
Because you don't have to send it out?
Well, let me share this with you. In effect, we had one student from UCSB. He could only come down on Fridays after school. My lab technicians are gone then. They've worked a long 5-day week. So my ceramist had the crown ready for us. It's sitting there like this little gem in a gold box. So we get ready to open the box, and the patient's sitting there and my assistant, and I'm expecting to see this beautiful crown. It's a front tooth, so it's key. And to do one tooth only is the toughest assignment in dentistry. If you're doing two, then you've got more latitude.
Interesting.
I opened it up. There was not one crown there. There were not two crowns. There were 4 crowns. This ceramist went above and beyond. He made 4 beautiful crowns with such subtle nuances that we looked at them and thought they're all gorgeous. So we thought, okay, we just started trying them in. Each crown would have been perfectly acceptable. We found one that we said, this is it. It's like it disappears in there. It's like it's you. You were
So
born with
matched
this
it up.
tooth. Just perfect. That's not something that every ceramist would give you. So we have the convenience. If you were to pay another lab to make 4 crowns like that, it would have cost you 4 times as much. So
Good.
yes. So I think there's savings in convenience, time, and your outcome is so worth it.
And we're just about out of time. A couple
Right.
more, at the
A couple
most.
more. Thank you.
Okay.
Thank you. All right. This lady, we did quite a bit of work on, and here's the before.
Wow.
I want to share with you that when her brother saw her after her dentistry was done, he said, "Mary, you are beautiful." Now, she knew her brother, and she knew that if he was telling her she was beautiful, it resonated true, and she felt beautiful for the first time in her life.
She told you that?
Yes. So, and she's a lovely lady. She looks beautiful. Would you agree?
That's a nice story. This is, I would call it like an extreme makeover. I mean, this is really dramatic. Couple more.
All right.
more.
Yes. Thank you. Thank
And
you.
then we really have to.
All right. Small things, big difference. Look at the picture. You'll see her upper lip looks very thin because it's stretched very tautly over the gum and the bone. So if you look at the upper picture, we recontoured that gum tissue and elevated the teeth up into the smile zone, as we call it, so that when she smiles, instead of seeing gums, you see teeth. And it made a terrific difference. She went from being a lovely lady to, I think, quite a beautiful woman.
Very nice. Okay.
Alrighty, this is a patient who presented to me because she wanted to know what could modern dentistry do for her. And she had a lot to be corrected, so we did correct her with a lot of porcelain. And I think that if you look at the before and after, would you say she looks younger, more
She does.
radiant?
It's actually a more attractive, like a pretty,
Yes.
almost a sexy smile
Yes,
in the after.
yes,
It is
is.
very nice.
Thank
So it
you.
isn't just teeth, like I said at the beginning.
Right.
I said, isn't it just teeth?
No, it's much more. It's a part of our whole person and personality. Yes, it's an expression. And my last one, Randy, pay attention to the fine details here. This lady had a smile that most people would think is absolutely fine. It's a lovely smile. However, she wasn't happy because the smile kind of went downhill.
Yeah, what do you see? I mean, when you're in front of her, like, what are you looking at that doesn't make this a good smile? Because it looks pretty good.
Yeah, I see that the gum line is going down. It's not being symmetrical with her upper lip. So we're seeing a gummy smile on her right side. So she wanted that corrected. She had a modeling career in mind. So we went ahead and raised the gum line there so it matched the one on her left. So she's got symmetry again. The eye is roaming a thing of beauty. And then when we completed that, she was kind to send us one of her first modeling pictures. Look how her teeth in the after picture follow her lip line almost perfectly.
Interesting. So you say, like on the before, that your eye picks up.
Oh,
I'm
yes.
not. I mean, it picks up like a flaw. I mean, what's your take on this?
Oh, yes, I see the imbalance of it. I see the asymmetry of it.
But you think the public, the average public, picks up that too? Picks that up?
You know, I'll tell you, after these people have their work done, they come back to me and they say, I see so many people who need to see you, and you know, including coworkers, family members, and they say, how do I approach them? What do I say? I don't want to offend them. So, you know, their dental IQ, as we call it, their DIQ, rises as they experience this transformation and they experience the joy of it.
Is that what you know, defines a great smile? Like something like this? Because it's just perfect on the lip line, nice and broad.
Yes, yes, and everyone's smile is different. They're all unique. They're not cookie cutter.
Because it doesn't look like veneers, by the way.
Thank you.
Which, going into this, I'm thinking,
Yes.
I could spot veneers.
Oh, I'm so
for you.
pleased to hear you say that. Thank you so much. That's an ultimate compliment.
So final message, we're out of time. Somebody watching this, they don't like their smile. Maybe they're afraid of the dentist. And maybe they're afraid of veneers for whatever reason. They're going to look fake, like I think or thought.
Yes.
What do you say to them?
I say don't let fear hold you back. Knowledge is power. So if you can muster your courage, get in to see your dentist and ask questions and find out what's available. Know that things can be made better for you.
Good. I want to thank you for coming to the show.
Thank you so
Great,
much.
great info. Thank you so much.
Thank you. It's my pleasure, Randy.
And all of these are on your website.
Yes.
Can they get them on your website?
Yes.
Good. Thanks again for coming on the show.
You're welcome.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit wellnesshour.com. You could put in Dr. Rich. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.